to our ma'am, over to you. Would you like to say a few things to our audience and address the gathering today?
So, firstly, thank you so much for the kind introduction, and I hope I live up to it. Also, thank you to all the participants in the program. I think it's very important program that has been initiated by SugarFit, and it's really my immense pleasure to have come onto this program as a speaker. Thank you so much, SugarFit, for organizing it, because it's very important for us to understand that diabetes is not just a problem of the metabolism, but it can affect different organ systems. And skin being the largest organ of the body, it's not something which is kept away from diabetes. In fact, many of the skin conditions come up and we are able to diagnose diabetes. So they are actually the first manifestations of diabetes. So here is an insight to what can happen to skin with diabetes, so that we have an awareness of it. People who are diabetic should also try to take care of the skin so that the manifestations don't become severe. They can be benign manifestation, they can be deforming manifestation, they can be life-threatening manifestations also. So that awareness is very critical. Also, in people, certain manifestations are the way that diabetes can actually, be an initial, in the very initial stages, and it can be diagnosed. So I've had very young patients, literally about 12 or 13-year-old, where we have come to know about diabetes because they have had certain skin manifestations. So do not neglect anything which is happening in the skin, saying that it is just cosmetic or it'll just pass through. If you see some changes which is happening in your skin, please go visit a dermatologist so that you can get a better insight into the issue. It may be very normal, but we should also know from the specialist saying that it's normal. So do take that as a take-home message after this talk. Should we start off?
Yes.
How
yes,
is it?
Ma'am. Thank you so much for addressing our gathering, and we will be starting with the questions. So if you have any questions, please write down in the chat section. We will be taking the Ashmita, we can start with the Q&A. So Ashmita is one of our finest coach.
I hope.
She will be taking up the session forward.
Yes. Am I audible and visible to everybody?
Yeah, Ashmita, you are audible and visible.
Okay, very good morning, everyone, and very warm welcome to you as well, Dr. Rashmi. Thank you for joining us all, and it's a great pleasure to have you with us. So, as you were mentioning very rightly about the signs that present before even getting diagnosed with diabetes, that was actually the most common question, as well as something that we want to know more about. So, can you just throw a little more light upon what are those signs and how can we be vigilant, about those particular signs with regards to diabetes?
Yeah, so diabetes and skin, as I mentioned before, there is a strong association, as there are many conditions wherein we are able to diagnose diabetes. When they come to us with skin manifestations, we are able to, send their sugar values, for assessment, for analysis. And then, we find out that they can be pre-diabetic or post-diabetic. And the reason for that is diabetes per se is a very metabolic disorder. So we need to understand that it's happening, it's affecting the complete body, and that metabolic disorder obviously will have an impact on the skin. So that is very important. So as I mentioned earlier, I've had very young patients, even 12-year-old, 13-year-old, and because of the lifestyle changes that is happening, that has changed post-COVID, one of the commonest manifestations they come up with when the parents approach me is the darkening of the neck, the velvety feel of the neck. And many a times the mother or the one of the parent will keep telling that, he doesn't wash or she doesn't wash that area too much. And then that's why, the dirt is collected. But it is not at all true. It is not the dirt. This is a very common conditions. Have anyone in the meeting has observed this? The darkening of the skin, especially in the neck area. People sometimes
Yes.
attribute it to necklaces which they wear, the thick necklaces which they wear. This pigmentation can also be there in the around the elbows, behind the knee, and these are fold areas where it typically happens. Correct. It is called acanthosis nigricans, Anjali. So it is a very common condition, and it is very common associated with metabolic disorders. So it's very important to assess it. So when the patient comes to me, the child comes to me, the first thing we do is to check their weight, height, the BMI is assessed, and we show them how the BMI has the impact. And so it is and that is why the pigmentation is happening. So it's not going to go away with washing. It's not going to go away with many creams also. So sometimes the parent thinks that it would go away with creams, but it's not so. One has to work on the metabolism, and I make sure that in those individuals we do get their serum insulin levels done. And then we guide them to a nutritionist where they are able to find give them a complete customized diet chart which is required for them, because children have their own needs which needs to be catered to. So it's very important to identify this condition. And one step further to the acanthosis will also be the skin tags, which will happen, also known as the acrocordons. So multiple acrocordons get formed, or skin tags get formed on the neck area, and also sometimes in the groin area and all the folds. And these are again the identifying markers. Why is the skin tag happening, let's say in the young age or even in an older age, and multiple in number? So some assessment of the skin tags have to be done, not just removal of it, which is the treatment of choice, but we need to do a lot of analysis and a background workup around it. So do not neglect these signs of diabetes. It could be just the beginning of things, so like a tip of an iceberg. So do consult your dermatologist, the specialist, and they'll guide you accordingly. So that is one of the most common conditions, Asmita, which we kind of see in younger individuals also. So we've seen a lot of that happening in the younger age group. The other common condition which we come across is the infections. Has anyone thought about it? The infections which happen with diabetes. All of us must have heard that diabetes reduces immunity, it causes infections, I mean, so on and so forth. But one of the most common conditions which happens is the fungal infections which happen in the toe web spaces. Has anyone heard of it? So these are called also as athlete's foot. So a proper care is very much essential, because as we know, it can lead to a progression of a diabetic foot. It can lead to an ulcer of the in the foot. So very, very importantly, we have to take care of that small infection also. So-called small infection, it can lead to a bigger thing. And so it's also known as the intertrigo. It can also happen in your web spaces of hands, and it looks a bit whitish in color, waxy in color. Of course, it is attributed to a lot of water influence, and also we have seen Asmita in especially closed people, men who wear closed shoes or who don't sweat a lot, and sweating by itself is a manifestation of diabetes. So we need to take care of the foot greatly. which we will be discussing,
Yes.
later on, because we know diabetic foot is one of the most common manifestation.
Yes. Common.
And one of the most important manifestation in that regard is the callosities which happen. So do not neglect your callosities. Keep checking your foot regularly. And all the callosities, especially if you're a long-term diabetic, this happens more when you have long-term, like, you have 10, 12 years of diabetes, is when we start developing this. And it's one of the signs of the diabetes affecting the nerves and the blood vessels. So we all know it affects the microscopic nerves, the microscopic blood vessels, and which is also known as a vasculopathic and a neuropathic diabetes. And when
Yes.
the neuropathy comes in, then the sensation reduces. We feel we are walking on cloud or mattress, and and then we don't realize that we've had injuries and things like that. So it's important to be very consciously available to that and seeing if there are any changes in that regard. So these are some of the most common things that we come across. It also tells us the glycemic control. So skin also is a reflection of how good and how well you're treating your diabetes. So the glycemic control of diabetes happens by certain skin manifestations. So if you just get a trigger of infections, it could be minor infection we call as boils, which some people get it, especially when shaving. And the typical pattern is a very recurrent infection. So when you keep getting these recurrent boils, then it is, needs to be addressed properly. And it also shows, are my sugars proper or not? Have you observed this, Asmita, in certain people where their glycemic control and
Yes.
their manifestation happens? Has that been observed by you?
Definitely. Yeah, what you're mentioning is half of the complaints that we get. Fungal infections very commonly
Hmm.
seen. Toe infections, and especially the foot manifestations that diabetes has is so profound, and people are actually ignoring it for a fact that
Yes,
they have to take so much care about their feet. That was actually one of the major thing that I wanted to learn about, how to take care of our feet in this terms while we are already diagnosed with diabetes, how to go ahead and taking care of that feet, because we often tend to overlook everything apart from our face. We are so much concerned
correct.
about our face, we just
Yes,
only taking care about that. But feet health and the cleanliness, and obviously taking care of it while you are suffering with diabetes is very much important.
yeah. Someone has here shared uh, there's a skin sharing which has happened. Are we able to discuss it
I request
on
everyone
this
not
platform?
to take the, this is something not acceptable, so please don't, I'm just going to remove the.
Yeah. So a very important discussion, Asmita, regarding the diabetic foot. But we also need to understand prior to it is what is happening in the skin. Also, there are changes which can lead to the diabetic foot, and which should not be missed. And one of the most important things which cannot be missed is the dryness of skin. So dryness is also a very important manifestation of diabetes. In diabetes, it's also known as, in scientific terms, in the dermatology terms, as cirrhosis. So, cirrhosis has a lot of reasons for it. And the primary reason is the barrier function of the skin is where the compromise happens. So, people who already have a drier skin issue, obviously, because of diabetes, it may happen more. This dryness can happen all over the body, typically seen in the legs, hands. These are the common things. And what it can lead to is what we call it as pruritus, which is itching. So massive itching and can happen. And diabetes is also related to itching because of its own metabolic, as a metabolic syndrome. A lot of chemicals which get released in the body and it's present in the blood, which can lead to this pruritus. So neglecting the dryness and neglecting the pruritus will lead to the next level of things, which is the infections, and then so on and so forth. It can lead to the diabetes also. So we have to start taking care of the skin at the primary level itself. So any changes of minor symptoms like xerosis, which is dryness, or even undue itching, especially in diabetics, has to be addressed by the clinician, by the dermatologist, because that's how we are able to manage. In the participants, do we, when you feel that your sugars are not the control is not much, you've had a lot of sweets, do you notice that you've started to itch a bit more? The participants, anyone? Do you notice itching can also happen in the private areas also? That's also a very common thing
Yes, they are
in
actually,
diabetic.
yeah,
So we do
they
say
are
yes,
actually
private
writing on the
areas.
chat box.
Yes.
Mm.
So private areas are very common. In case of females, it's known as vulvovaginitis. In case of males, it's known as belinitis. It could also be one of the first manifestations of diabetes. So do not neglect it at all. I have seen a lot of abuse happening in that area. I would call it abuse in terms of people going to the pharmacy, picking up over-the-counter creams. That leads to a lot of issues, because, and this is a platform where I would like to create that awareness. Please don't do that, because the pharmacist is definitely not equipped with it. Most of the creams which are given by the pharmacist is steroid based, and the steroid is just going to harm the skin in that area, and also your diabetes. We are all aware of it. So a steroid will be like a mask where you just hide the condition. You may find a relief in itching, but it's definitely going to make it worse. So consult the dermatologist. Nowadays, we have a lot of creams which are, which have anti-pruritic in nature, what we say is anti-itching. Very nice creams. And what we also prefer a lot is the creating a good biofilm around the skin area. And the reason for that is that we all know, because of our hyperglycemia in the blood, in the tissues, it also of course seeps in into the skin. So there's a lot of glucose which is present in the skin in the diabetes also, especially through the secretory tissues of the skin. It could be the sweat glands, and it could be even the saliva. When we check the analyze the sugar values in these areas, we find a higher glycemic levels. And as we all know, glucose is important for all the organisms to grow. So it's a huge bed of food that we are providing to all the organisms. And skin being a protective structure, it just loses its barrier. So it's very important to create a conducive environment for the skin to protect us. We all know skin protects us from various things, like HIV virus cannot get into an intact skin. Um, COVID virus cannot get into an intact skin. So that's how the protective capabilities of the skin is, which typically I'm very passionate about. So we have to nurture it. It's up to us as to how we take care of it, various ways, just not at the level of skincare,
Yes.
but at the level of various things. So Asmita, what I have started doing over the years is not
Yeah.
just working on the skin is what is important. It has to work through the body also. So one of the most critical things
Yes.
is to hydrate the skin, work on a diet. And one of
Hmm.
the most important things which I have worked on, and we've got very good results with, is to use probiotics. Um, what is your opinion on that? Probiotics.
Hmm. Yeah.
Absolutely, ma'am. Probiotics.
Oh, clearly. Yes. Hmm. Yeah. I
I
think
think
Neha, you were saying something.
Absolutely, ma'am. So again, like, in the probiotics also, when we talk about, there are two varieties of probiotics, like, completely going with the dairy sometimes aggravates the situation, but then having the probiotics in the right form from the kombucha definitely take care of your gut health and helps in improving the gut
Yeah.
furthermore. And our entire immunity, our health lies in the gut. So definitely when we invest in the gut health by giving it the probiotics at the right time in the right form, definitely improves our skin health, also helps in neutralizing the glucose molecules, which again stabilize your glucose and the glycemic control, helping you to further improve these situations.
Yes. So very rightly mentioned. So probiotics have now really done a lot of good. And in the participants, do we all take some probiotic form? Has it been? Are you aware of it? The importance
Yes,
of probiotics.
yes, they all are into the, because that's one of the mandatory part of the sugar fit protocols
Excellent.
that we put them
Excellent.
on the
Yes.
Yeah. And
Yes,
believe me, it really helps in so many skin conditions, right from acne to dryness to allergies, which in Bangalore we all face a lot. Dryness is, part and parcel. Through the year, dryness happens. Through the year, allergies happen. So it's very important that we look at things which can be sustainable, especially usage of intake of probiotics. It could be in the form of food, and which I'm sure the Neha and Asmita would be able to guide. So probiotics are a very important part and parcel, not just at the level of the body by itself, but also by it in terms of skin health. So do look into it at a very in a decisive way. Apart from that, we also see certain manifestations which are very typical of diabetes. One is called a diabetic dermopathy, where long-standing diabetes, there are dark patches which are seen on the typically in the shin area, dry patches which are seen in the shin area. This is very common. And the second thing, of course, there are two important conditions which are literally the most unique for diabetes, and that is the diabetic NLD is what we call necrobiosis lipotica diabeticorum and granuloma annulare. Again, they have different manifestations. So anything that you feel instinctively, which is not something which is normal, please look into it and get it tested by the dermatologist. So that is very critical. These are two significant conditions which are like many people just come with that condition and we then say this is part of diabetes. So we, immediately the anti-hyperglycemics are given, and it helps a lot in, the condition. The other part of the story literally is the how the medicines can also affect the skin. So there are a lot of anti-hyperglycemics which can also have an impact on the skin, and that we should be aware of. So especially insulin, and it can have its own lipoatrophy and things like that. And then of course we have a lot of hyperglycemics which can cause allergic manifestations, dryness by itself, and so on and so forth. So the basic idea is to be a bit more conscious of things, and understand what the signs the skin is trying to give. And as skin is a visible organ, it is the largest organ. The visibility factor is what is good about it. We don't need something very extra to diagnose it with. So these are visible. So keep checking your skin in different parts of the body so that it can be worked earlier than later. And as we all doctors like to say, a stitch in time saves nine. So it's very important to work on this motto
very
in
true.
everything in life. Yeah.
Very
So
true.
anything else that we would one would like to know? I mean, I'm happy to
Absolutely. Ma'am,
guide.
even like,
Yeah.
we would like to know a couple of more things. I hope, we will take a few more minutes from your routine. So,
Sure,
yeah,
sure.
Ashmita, you can go ahead. Ashmita, I guess there is a network issue at your end.
Yeah.
I will take it.
So one more thing, Dr. Rashmi, that we find. Yeah. Am I audible?
Yes,
Hello.
Yeah, yeah.
Yeah. So one very commonly, a very common trend nowadays are tattoos and piercings as well. So how safe would you think, Dr. Rashmi, it is for a diabetic individual to go ahead for such an experimentation with regards to, tattoos or maybe piercings? How well or how safe are they?
So, as a dermatologist, not just because I'm a dermatologist, but of course we know about tattoos, but generally, like as a person, like, we don't want to interfere with things. So, I am not in favor of tattoo per se, not just in diabetics or in diabetics. I can share some of the allergic reaction which happens in diabetes. We have it on my Insta page as well, where we have, got the tattoo and which has caused an allergy, and then we've treated it. So, and typically any tattoo material, it goes into the lymph nodes, because that's how the body kind of ejects it through the blood vessels and everything. The lymph are the areas which will also try to excrete it. So, these many studies have been conducted over the years, and it's been scientifically proven that these tattoo materials are actually seen in the underarm lymph nodes also, especially if you are doing a tattoo in the hand or different parts of the lymph nodes, because lymph nodes are areas which are present in different parts of the body. So, so we have seen, so tattoo doesn't remain in the skin, is what I'm, trying to mention here. It is going into your body
Yeah.
system, and what happens then is not in our control.
Correct.
So, ideally speaking, whether you're diabetic or not, we should not be encouraging this as much as possible, is what my
Hmm.
thought process is. Um,
very true, ma'am.
Apart from
I
that, if
Understood.
you are really looking at it, then of course take the due precautions, especially if you're a diabetic. Make sure the person they are doing it is in extreme hygienic conditions. Take your maybe use some antibiotics before going to them. After procedure also, you need to use these antibiotic creams. These are very critical in the whole thing. Yeah.
Okay.
And any trauma basically can
All
infuse
right.
a lot of other things also. Any trauma to the skin, there is a phenomena in dermatology which is known as Cobner's phenomena, which is basically trauma-induced conditions. And what are they? It could be as simple as, not as simple, but a condition called viral warts, which can be triggered by trauma. It could be even pigmentary changes, which can happen because of trauma. So we don't want any trauma unnecessarily happening.
Very true, ma'am, and completely agree. And it's very
Yeah,
important. Thanks for giving so much of insightful information about the diabetes and the skin health. Many people are not even aware, and I'm sure that they are getting
yeah.
more awareness, and that was the entire purpose of the series. And one more question that I want to take up from the audience. Shirita wants to ask that what is the solution for the dryness? Because dryness always comes
Hmm.
along with the diabetes, and it's one of the major problem. And we cannot stop the medications, but few things. What are your suggestions for a diabetic
Yeah,
person to avoid dryness?
yeah. So we've been guiding. It's a very, very good question. So firstly, thank you for this, and so that we could, discuss this as much as possible. So thank you for the question. Um, Moisturizers are the key, and there has been a lot of discussions around moisturizer, what kind of moisturizer, and things like that. We also need to understand briefly on the anatomy of the skin for that. And the anatomy of the skin is the topmost layer, which we also say as a dead cell layer, has an envelope, which is called the cornified envelope. And this cornified envelope is the main barrier of the skin. It is it's like wearing a jacket, you know, uh, which will help us to protect ourselves. And if there are holes in the jacket, what will happen? Obviously the jacket is not fulfilling its function, and this is what happens when the cornified envelope gets damaged. Then obviously the barrier function of the skin can get compromised. Now, why does the cornified envelope gets damaged? The reason is also the structure of it. The structure of it is 3:1:1, 3 of ceramides, one is of cholesterol and one is of free fatty acids. So this is the ratio. This is the ratio which is present in our human skin. And we are not able to compensate it with a plant-derived product or something like that. We have to have a specialized moisturizer which will have which will mimic the human skin cornified envelope, and that is what will moisturize. So these are called as NMF, natural moisturizing factors, and these are the products which need to be put into the skin. So ceramides, cholesterol, and free fatty acid in the ratio. Any change in the ratio, any change in the structure of the ceramide, if you don't have the ceramide 1 and 2 and you have the rest, the dryness comes. If you have changes in the cholesterol, then dryness comes. So that's why we see many individuals who are taking anti-triglycerides and things like that, they again develop a lot of dryness because of this problem. So this content is very important. The other important content is present very deep within the skin, that is in the dermis of the skin, and that is called hyaluronic acid. And I think it's been one of the most common cosmetic product. Everyone knows about hyaluronic acid. My daughter, who's just when she was 10 itself, she was talking about it. But the anatomy of that hyaluronic acid is very deep in the skin. We will apply it on the skin layer, but it's not going to function like the ceramides, the free fatty acids, and the cholesterol. So we have to understand what is there in the skin anatomy and what will help us. So pick up moisturizer. There are fantastic moisturizers available right now, which will help in replenishing that the cornified envelope things. Apart from that is how we use the body wash, because water, again, we know hard water, many people complain. I've come back to Bangalore, I see a lot of dryness, the water is hard, it's leading to a lot of issues. It's a very common thing. And hard water will again take out it will lead to surfactant action and remove all the free fatty acids. So we need to again use a body wash which can keep some things intact or create a bit of occlusion, like oil-based products, which can create an occlusion so that the water is not able to really go deep. So oils will work as more occlusive. So people who use coconut oil, it's fine, it's good, but it's creating just an occlusion. It's not going to give the moisturizers which are there in the human skin back. So do remember that. And hyaluronic acid, as I was mentioning, works on the principle of water. So it will absorb the water, it will, spread like a sponge. So it retains water. So the water loss, which is happening constantly through the skin, also known as the transepidermal water loss, is contained. So hyaluronic acid is also very important to contain that, because it's going to absorb the water molecule. And that's why you need to also give more water to it to work. So intake of water, hydration is very critical for dry skin. So thinking that, okay, I've used this moisturizer, it's a great moisturizer. I've also used a good body wash, but I'm not drinking enough water, will not serve the purpose. So dryness is not just related to only the application, is what I would like to mention. It is also related to other things, as simple as even sleep, for that matter, is very critical for dryness, because sleep is the time when all the skin gets, the maintenance happens throughout the body, not just skin, but there's a huge maintenance body undertakes in sleep time. So that sleep is also very critical. And there are many disorders in the skin where the sleep is inhibited. So we make sure the part of the treatment is to get the sleep back as well, the sleep cycle to be back. And of course, then there's no, two things about the importance about the diet, which plays again an important role in dryness, which is a lot of vitamin A in the diet, because that again keeps the barrier function of the skin intact. So if we have to step by step work on it, firstly is the moisturizer, the right moisturizer. Again, the dermatologist will be able to guide you. If you have very strong dryness, there are conditions like ichthyosis and keratosis pilaris, which will require different kind of cream. So moisturizers, a good body wash, oils if necessary, and then of course diet, rich in vitamin A and hydration. So this is how, and sleep. So these are important things when we deal with dryness.
Thank you so much, ma'am. I think it was quite insightful. But apart from that, ma'am, people will also would like to know any suggestion. I know that people have different skin type, and you must be taking a call personally on the basis of personal consultation. But any skin moisturizer that you would like to suggest for the dry skin, especially keeping the diabetic people in mind, or we need to be very specific with that respect?
Ideally, it is requiring some specificity because skin care is also related to a lot of lifestyle, how a person leads his lifestyle, what happens, is he able to do that kind of moisturizing? Because again, the number of times we tend to moisturize also is important, But then there are some good ones which are available there, and the ease of using the moisturizer. So something which I like many a times is this Cetaphil spray moisturizer, which is a spray, and so you just spray it, and then you just moisturize it, and it's not very sticky. So keeping these around you, it always helpful. Around your desk. So legs, again, you can just spray bigger body areas, very easy. There are many more like that which are available. So, but this is something which I like because it is also easy to use. So even if you're in the office or there is some time that and hands, and so that helps. Of course, many products nowadays have come up with a lot of specificity. So there are there was a question on foot moisturizing. So there are products available for foot itself, because we we have to acknowledge that skin is very different everywhere. So our facial skin is different, the hand skin is different, the palm skin is different. Similarly, the sole is different, the leg skin is very different, and it's extremely different everywhere. And the groin area and chest and back, everything is very different. So we have to get certain specific moisturizers for a particular body surface area, and that is there. So there are a lot of creams available which are specific to hands from the medical perspective. So similarly, even for the foot. Now, foot, there was a question, so I'll just take it very quickly. There is, so in the foot, it's a very different thing. And as we already have discussed, the diabetic foot is very important to manage. We don't want it to go to a severity where it can lead to a gangrene and intervention. So it's firstly, foremost, moisturize it very well. We also need a lot of products which are able to shed out the dead skin. So in the foot, typically the shedding pattern of the skin is a bit low, so it doesn't shed. And when there is a dead skin accumulation, the cracks will start forming, which happens typically in a callosity or even the heels. So it's very important to get the shedding process going. So the creams are there which will help in the normalizing the shedding of the skin. And once that happens, then the renewal mechanism of the skin is more streamlined. So because the skin is constantly shedding, but we don't want it to get accumulated. It should happen naturally. One skin cell will shed, the other one will remain, so on and so forth. That shedding process is what needs to be curtailed. And so there are moisturizers which are specific to that. So do use the moisturizers regularly for the foot. There are many available. Some of the names, if I can mention, is there is Moisturex, there is Olisoft, PPK, there is Happy Heal, things like that which will help. And so moisturizing it at least minimum 2 times daily. And whenever you wet your foot, keep it dry. Keep checking the web spaces for any changes there. And nails, again, are very important. Nails to be cut properly, and any nail discoloration, because that is again one of the few signs of diabetes. The fungal infections of the nail, also known as onychomycosis. It needs to be treated ASAP, because it is an infection, and it is typically an infection of the nail bed. It's not the nail. So just removal the nail will not take it out. The nail bed has to be eradicated of the fungus. So we need to give some antifungals there. So do not neglect these things whenever there's a nail discoloration of any kind.
Thank you so much, ma'am, for the recommendation. I think that the conversation is getting so interesting. We don't feel like ending this
I know,
session
same
today.
here, same here.
It's really so insightful, and it's always good to know yourself, your body, and how we can take care of different concerns. And sometimes we neglect it also. And I'm sure, like now, people are going to monitor and observe
Yeah.
a minute changes in their skin and in their body. And I always suggest that please meet a good clinical dermatologist for all the concerns, because you need a one-on-one personal consultation, which is completely person specific. We cannot give a complete raw guidance to you over here, because it's not the right platform. But the awareness what we wanted to create, I hope you could understand and you got a lot of more information. Apart from that, ma'am, I just wanted to take a moment more and thank you for spending the time today with us. And I'm looking forward for tomorrow's conversation, much more excited.
Same here. Yeah. I'm really happy the participants were also part of the program, and that is what we want, it has to be a two-way discussion. Do attend tomorrow's program, post in the questions if possible today itself, so that we can work around the talk accordingly. And but happy to take any questions if anyone has even now.
So there is a question, ma'am, from Maria, that she has a toenail fungus where two nails were removed, yet the nail has grown back black again. So how she should, what will be your advice for her? How she can take care of it now, because it's regrowing again.
So firstly, what we can also do, Maria, is that we can also test the nail for the fungus. So we do an analysis where we take the nail, we put it in a medium called KOH, where it removes the keratin of the nail, and then the fungus is shown. So that is one of the things which can be done. And it's a simple technique, because, it's not very invasive. Apart from that, we'll have to, if it is turning black and all, we'll have to also assess the vasculopathic nature of it. Is the blood supply to it and all is proper? So that needs to be definitely analyzed clinically or with investigations. If it is fungal, then of course we'll have to give the antifungal. And this is something which I wanted to also mention, that when person has diabetes and skin associated conditions, then the treatment is definitely prolonged. In a normal individual, if it takes about 6 to 8 months, the diabetic individuals, it takes a bit longer. So we have to be prepared for that longer treatment, and because that's how things will work. So many people have this notion that especially fungal infections will go away in a week, because normally antibiotics work in a week. But antibiotics are for the bacterial infection, and fungal is a very different organism. Even one fungus is enough to just grow up whenever your sugar levels go up. So it's very important to eradicate it completely. And we have a lot of antifungals which are working very well. In terms of, we in fact have nail lacquers, antifungal nail lacquers, which are available. From your side, the care needs to be in terms of foot. Make sure it's not kept wet. It has to be kept clean, dry it, keep it very dry, or not too much of water coming into the foot. If you're wearing closed shoes, then you'll have to change the footwear, keep it aerated. Even socks, for that matter, has to be changed very regularly. Many people with, as we discussed, with diabetes also have hyperhidrosis, which is more sweating, and that can also have an impact. So use some foot powders if necessary to, absorb the sweat. And these are some tips which can be given. So work on your footwear as well, which is very critical in diabetes. Do not neglect good footwear. Pick up customized footwears which are available also. So it's very critical.
Excellent tips, ma'am. And I'm really grateful, because I think these were the amazing tips that we can follow and save all these conditions. But apart from that, ma'am, I also believe that glycemic control is very important.
Yes, yes.
How you maintain a
Obviously, yes. That
lifestyle,
goes, yes.
because it's actually the outcome of the uncontrolled
Yes.
diabetes. And if you are not taking care of your
Yeah.
health, you are not taking a charge
And
of
also long-term diabetes, Neha. I think,
Exactly.
that 15, 20 years when the blood vessels and the nerves have gotten involved is where the whole process starts. So it's
So that
absolutely
is
important.
the first approach that one
So
should.
reversal of diabetes is always good.
Absolutely. Thank you so much, ma'am, for giving us your time today.
My
And
pleasure.
we have Maria here. She wants to share her journey with us with respect to the skin issues. So if she's still there, I would like to unmute her so that she can share her story with us. Ashmita, can you just check quickly?
Yeah, I can see her. Uh, I've asked her to unmute as well. She's, I think, on
Yeah,
unmute. She
hi.
is unmuted.
Monica, no? Monica.
Hi,
Yeah.
good morning, everyone. Yeah, I've been diabetic for nearly 10, 15 years. Okay. And I found that, for my job, I had to go barefoot, like, say, I'm a tourist guide, so going to temples and other places where you have to go barefoot. And then I found that I picked up this fungal infection on two of my toes, you know. So now I wear socks and I go around, but they got the toenail removed, but it's still black. It's growing black and hardened, and it overlaps in the growth. And like I thought, there was a corn also underneath. So the doctor has given me an application, a nail application to be put, and she says you have to live with it. So that is something I don't agree because it looks ugly, and I have to, top of it put some nail polish so that it is covered.
Yeah.
So
yeah, sometimes what happens, Maria, is that when the nail bed, as I was saying, gets affected, this is where the nail grows. So when the nail, when this gets damaged, typically because of trauma, someone has just put your foot on you, and you've had or you've hit something very hard, or it could have happened sometime, which we are sometimes not aware of. The nail bed gets damaged, and then you have a condition which is known as atrophy of the nail. The nail cannot grow properly. So it's not very easy to do that because one is you don't even know the visibility of the trauma at all. So typically what we do is we try to stimulate the nail. We do a nail avulsion where we remove the nail, give it. There are certain tablets which are helpful for nails, which will give the desired nutrients for nails, which are available, which can be thought of, so on and so forth. But typically, once the nail bed gets damaged, it's not a very easy thing to treat. So, firstly, we'll need to see where the damage has happened. Antifungal, giving an antifungal also is, can be thought of depending on whether there is a fungal element involved. So these are different options available.
Where can I get it done? Can I do it through Sugarfit or do I have to do it with a local doctor?
I think we'll discuss that and get back to you. Neha or anyone from the team will be able to contact you, and we'll be able to guide you.
Or whatever
In the meantime, if it could be great if I could get a picture of it. So that would be really helpful.
So how do I send it to you, Neha?
Yeah, I think one of the
you,
team
don't
members
worry.
will contact
We
you
will
on
reach out
that.
to you. I will ask the coach to reach out to you. You can send it to the coach. We will get back to you.
Where do I?
Ma'am, you can send it to the coach. We will get back to you. Thank you so much, ma'am. I think thanks a lot for sharing your expertise on diabetes and skin health. It's been incredibly informative session, and we are looking forward to the session, ma'am. Thanks a lot. Thank you, everyone, for joining us today, and we are looking forward to see you again tomorrow. And keep on posting your queries over here, and we would love to take them one by one. Thank you, Dr. Rashmi. Have a wonderful day ahead.
Thank you. Thank you. Thank you, everyone.
Thank you, Dr. Rashmi.
Thank you so much. Thank you for being there.
Yeah. Neha, I think you're on mute, Neha.
Hi, sorry, thank you, Ashmita. Monica, you can talk. You can unmute yourself. You wanted to talk, right? And you have been asking from such a long time. We want to
Yeah,
know.
hi everyone. Am I audible?
Yes, yes, you are audible.
I think there's a person who's talking about some skin activity, na?
Ma'am, your voice is breaking actually now.
I'm saying I just want to give two things to people who's there. Actually, I got to know about my HbA1c like 1 month back. I was not aware. Before joining SureFit, I was with nutritionist counseling for 6 months for. So my this area was complete black. My this area having all black patches. So they have
Sorry, I'm not able to hear you, Monica. There's a lag in the voice. I think there's some network issue.
yeah. Audible?
Yeah, you're audible, but the voice is on and off. It's not very clear.
I don't know from your end because my end is complete.
Um, I think, Monica, you can write down in the chat because we are not able to
Okay,
hear.
okay, okay.
Ashmita, you are able to hear her?
I can hear you, but I don't know about the rest
Yeah,
people.
no, the
Actually,
voice
the
is getting
connectivity.
broken.
Yeah, voice is
So
not clear. Monica, I'm writing you
clearly,
my
we
email
can
ID.
take
You can write down. We can
take
take
the
the
question up from the
chat
chat
tomorrow.
box and we can revert. Yeah.
Question. So we have another episode tomorrow. We have 4 sessions. So please write down to me. I'm dropping down my email ID to you. Thank you so much, everyone, for joining us today. It was really a memorable session, and I hope you all enjoyed. For tomorrow's session, it's the same link. Please send it to your friends, family members, so that everyone will get benefited. Thanks a lot, and have a wonderful day ahead. See you all tomorrow. Thank you, Ashmita. Thanks a lot for taking this up.
Thank you, Neha. I'll see you tomorrow.
See you tomorrow. Session is at 11 tomorrow, so please note, everyone. It's not at 12, it's at 11 o'clock. Thank you.